Just a couple of things to remind us of what's going on. And I've had a number of people that I've heard say, well, how can we be having such a large epidemic and large outbreak if vaccines work? We have a significant proportion of the population vaccinated. So obviously means that vaccines aren't working if we're seeing this type of explosive growth. So I think two things to kind of keep in mind. The first is just the principles of exponential growth, as we've talked about before. So if you have a virus that has a reproduction number of 3, an R value of 3, every generation of cases increases by a factor of 3. So one person infects 3 in every generation. So you can see, starting with one case, by the 4th generation, you're already at 27, and it goes on and on. Next, the next thing to keep in mind is the reproduction number and how that reflects behavior in the community. So as we all know, that reproduction number is how many cases a person on average is expected to infect. And there's a number of things that impact what the reproduction number is. The first is the likelihood of transmission. So if somebody is infected, what is the percent probability that they are going to infect somebody else that they have contact with, right? Is it a high proportion, like that big thick arrow there, that you are going to infect somebody else because you're shedding lots of virus because it takes fewer virus particles to infect? Or is it like the lower arrow, where there's a lower likelihood of an individual contact resulting in transmission? The second factor is how many average contacts does a person have during a course of infection or during the course of a day. So people who have twice as many contacts are potentially able to spread to twice as many people. And again, remember, these are all based on averages and congregate calculations across populations. And then the third factor is how many of those people that you have contact with that you could potentially spread the virus to are already immune, are already protected against infection, and therefore won't develop infection. Next. And when you put all these together, you start to see what we're experiencing now. So we're going to talk about a notional town in the middle of the country here called Epitown, USA. We're going to look at an outbreak really quick. Next. So in Epitown, USA, everybody has about an average of 16 close contacts. All right. So that's the number of people that you could potentially transmit to. Next. Now, if you look at that, everybody here in this ideal population is non-immune. So all of those 16 are non-immune. And we're going to look at the behavior of what is the quack virus. It's a virus that turns you into a duck. And we're going to look at how that spreads through the population based on population immunity. Again, next. Oh, there we go. So you can see if the quack virus has a basic reproduction number of 4, that means in ideal baseline conditions, when everybody in the population is susceptible, the average person can be expected to transmit to 4 people. So there's that index case on the left there, who's now a duck because they caught the virus. And of their 16 contacts, which is the average for Epitown, USA, they can be expected to infect 4 people. So 4 people will have turned into a duck. Next. Now, at 10 generations of cases with an R of 4, that means there's going to be 262,000 ducks based on 10 generations of those cases with an R of 4. Next. Now, let's look at Epitown after a vaccination campaign. So if you've effectively vaccinated 50% of the population and made them immune, or if there's a combination effect where vaccination plus some of the immunity that is imparted from prior infection gives you half of the population that's immune. Let's see what happens then. Next. So in the same Epitown quack virus epidemic, you can see that half of the population is essentially taken off the table because they're immune. Even if you were able to transmit the virus to them, they're not going to get sick and they're not going to develop disease and they're not going to pass on to somebody else. So your possible pool of infectees is cut in half, and therefore the number of people you infect is cut in half. And so your effective reproduction number at that point is cut in half to 2. That's a huge difference. Next. Right now, let's imagine that you have 75% of the population now immune, either from vaccination or prior infection, and from a combination of both. Then, in theory, you will have cut your effective reproduction number down by 75%. And so it's only a quarter. So now your effective reproduction number is 1. So each infected person will only infect 1 other person. Next. So this is how essentially the reproduction number, or R, is related to the number of people who are immune, primarily immune through vaccination, but certainly there's some immunity from prior infection. So you can see that your effective reproduction number equals your R naught, what it is at baseline in an ideal fully susceptible population, times 1 minus the proportion of immune. Next. So let's look at how that has been affecting behavior throughout this pandemic. So again, the R naught there, you can see in parentheses, is essentially that basic reproduction number for each of these different variants. And these are close approximations. They are not exact by any means, and they are somewhat educated guesses as well. But the Wuhan strain probably had a basic reproduction number, modelers estimate, of a little less than 3, probably between 2.5 and 3. We'll round up to 3 and call it there. So you can see in March of 2020, we were essentially dealing with a virus that had an effective reproduction number at that time of about 3, because we had essentially nobody in the population immune. However, very early in the spring of 2020, we were able to implement a lot of effective non-pharmaceutical interventions, shutting down large gatherings, shutting down workplaces in many instances, et cetera, et cetera. So we were able to limit contact, even though we didn't necessarily increase the number of immune at that time. Now, if we think about the Alpha variant, which had a reproductive number of about 4, a little bit more than Wuhan strain, and then Delta variant, which probably had twice the R naught of the original Wuhan strain, you can see that even if 50% of the population was immune, you would still have an effective reproduction number that is the same as the Wuhan strain, or what we experienced in March of 2020. Now, I think with vaccination and with prior infection, the Delta wave that we experienced here in Nebraska is probably what you see here, there, with an effective reproduction number about 2. I would say about 2/3 of our population, essentially with vaccination and with prior infection, was effectively protected against Delta variant. But you can see, even with 60% of the population immune, you're still dealing with a virus that has an R naught an effective reproduction number of 2. Now let's fast forward to January of 2020. I think that, essentially, to be protected against Omicron, you probably have to be boosted and or vaccinated relatively recently, within the last few months. And prior infection probably gives a very small amount of protection, as we've seen from studies in South Africa and the UK. There's a much, much higher rate of reinfection with Omicron than previous variants. So let's say, for argument's sake, I think a good estimate is we're probably sitting at around a 40 to 45% effective immune rate within the population. So that means that we're potentially looking at a virus that's going to behave like a virus that has a reproduction number of 5 to 5.5. Right? That's way more than what we experienced in March of 2020. So if we think about what we're seeing in New York and New Jersey and Maryland and things like that, how is it so explosive when we have so many people vaccinated? Because the basic reproduction number, the R naught of this virus, is so much higher than the R naught of the virus that we faced in the spring of 2020. And so that has a massive effect, even in a population where you see large percentages protected by immunity. So this is why we're seeing such explosive growth. And this is why we're going to see that here within the next couple of weeks, now that we're kind of at that tipping point where more than half of our viruses are Omicron. Things are going to move very, very, very quickly. And we're going to see the types of workplace absenteeism rates and overwhelming surges in cases that we've seen on the East Coast now. Next. Now, we still have tools to be able to potentially mitigate the spread of these viruses. So let's say that even without changing the number of immune in the population, we can reduce the likelihood of spread from one person to another. So remember, in that diagram, taking the big thick arrow with lots of viruses in it and make it a thinner arrow, where each person individually is slightly less able to transmit. And we do that through things like wearing face masks. So we reduce the virus burden that people are shedding, and we reduce the virus burden that people inhale. We also do that by increasing ventilation, by doing things outdoors or in larger volume spaces rather than in small enclosed indoor settings. And let's say we're only able to reduce the reproduction number by a quarter doing those things, right? So we reduce that likelihood. So instead of infecting 4 of your close contacts, you infect 3. Next. Now, when you look at that over time, that has a huge impact on the number of cases that you generate. So if we're able to knock it down by a quarter and get a reproduction number of 3 after 10 generations of cases, you can see that you've eliminated the vast majority of cases or people who will be ducks by generation 10, 260,000 versus now fewer than 20,000. So a huge impact from doing that. Next. If we now look at eliminating the number of contacts we have by eliminating people going to large gatherings, by going to restaurants, by going to bars, by going to, indoor sporting events where they're not wearing masks, right? Let's say everybody's able to cut down the number of contacts they have by half. You essentially now reduce the effective reproductive number by half. So now you're only infecting 2 people. Next. And so there you go. You only come in contact with half the number, so you only create half the number of subsequent cases in the next generation. Next. So when you look, all right, keep going. 10 generations down the line, there you go. Instead of 260,000 ducks that you've created at generation 10, you've only created 500, right? That's a huge impact. And disproportionately large compared to what we can think of. Oh, we only cut the reproduction number in half. Well, 10 generations down the line, that's a huge effect. So that's where I wanted to stop. This kind of shows you why these things like non-pharmaceutical interventions are so important, why we're still seeing huge exponential growth rates, even with a significant proportion of the population that's protected from vaccines, and why what we're going to face here in the next couple of weeks is going to be the worst thing we've seen in the pandemic yet, especially since our vaccination rates are nowhere near what they have in New York and Maryland and much of the East Coast.